In today's episode, we'll be looking at fetal growth, a week-by-week journey. In week 0, fertilization begins. Conception starts when a sperm fertilizes an egg in a fallopian tube, forming a zygote. Over the next 7 to 10 days, the zygote will divide rapidly and it will travel to the uterus for implantation. Note that if implantation occurs within the tube, it leads to an ectopic pregnancy. In week 4, pregnancy is confirmed. The amniotic sac and placenta begins forming. The heart and blood vessel starts to develop. A practical tip here is to note that a missed period and a positive pregnancy test marks this stage. At this period, the woman is expected to start her prenatal vitamins and avoid alcohol and smoking if she hasn't started doing that already. By week 6, there's early growth. Here, the embryo reaches about 1.2 cm. The head forms and a heartbeat will be detected. An ultrasound scan done at this stage can confirm pregnancy location and viability. Miscarriages and ectopic pregnancies are common concerns at this period of pregnancy. By week 10, the baby has moved from the embryo stage to the fetal stage, and the baby measures nearly 4 centimeters. Facial features, limbs and bones begins to form. A scan done here helps with bonding and reassurance. By week 12, the baby is formed and moving. At about 7 cm, all the organs are formed and movement can be seen on ultrasound scan. A chorionic villus sampling may be offered for genetic testing if necessary. At week 16, the fetus is active and developing and measures about 13 cm. On ultrasound scan, the fetus can be noted suckling the thumb and the heartbeat is audible via a Doppler. Amniocentesis may be done for further genetic testing, and gender can usually be identified. By week 20, the pregnancy has gone midway. The fetus grows to about 21 centimeters and weighs about 350 grams. Hair called lanugo and skin protecting vernix will appear at this time. This is usually the time for an anomaly scan for people who are worried about fetal anomalies. At this stage, iron supplements are started, and if applicable, malaria prophylaxis. At week 24, the fetus has commenced gaining strength. The fetus now measures about 30 centimeters, weighs about 900 grams, with visible lashes and brows. With medical care, survival is possible if born at this stage, but risk of disabilities are high. Hence, delivery location should be planned in a facility that has neonatal intensive care unit. At week 28, the baby is growing ever stronger by the day and weighs about 1.4 kg. The fetus now reacts to sounds and changes position often. Neonatal intensive care is vital if delivery occurs at this stage. Of course, the women are told to continue antenatal care checks. By week 32, the fetus is now nearing readiness, weighs about 1.8 kg and is about 44 centimeters long. Fat accumulates at this stage and movements are much stronger. If delivery is imminent, ensure the hospital has ventilatory support. At week 34, we are almost there. The fetus grows to about 2.2 kg and measures about 47 centimeters in length. The nails reach the fingertips and movements intensify. Most babies born now will survive with minimal NICU support. At week 36, we're now preparing for birth. The fetus weighs about 2.7 kg and measures about 49 centimeters. It usually settles into the birth position. If the baby is breech, discuss the delivery options with your doctor. At week 38, we're now at full term. The fetus reaches about 2.9 kg or more and measures about 50 centimeters. The fetus is now ready for birth without special care if the pregnancy has been low risk. Doctors may suggest labor induction in high-risk pregnancies. At week 40, this is the due date. The fetus measures about 51 centimeters and can weigh up to 4 kilograms. Movements will slow down as the space becomes restricted. Though it is the official due date, only 3 to 5% of women deliver exactly at this stage.